aim of our work in portec in intermediate risk patients is to decrease overtreatment and to improve quality of life of the patients. The aim of the portec-2 trial was, it was a randomized trial randomizing external beam pelvic radiotherapy to vaginal brachytherapy in high intermediate risk patients. And the rationale of that randomization is that the majority, more than 75% of the recurrences are located in the proximal vagina. And the vaginal brachytherapy is a very conformal treatment aimed at those recurrences. The hypothesis was that it was associated with less treatment-related toxicity than the standard at that time external beam radiotherapy for these patients. So the aim of this abstract and this work was to provide long-term results of the randomized trial, but also to address risk factors for recurrence in these patients. So with now a median follow-up of 10.5 years, we confirmed the main outcome of the trial, that vaginal brachytherapy is very effective in preventing vaginal recurrence in these patients with a rate of approximately 2 to 3% at 10 years. We did see a slightly increase in the risk of pelvic nodal recurrences. However, that is, the majority of these recurrences are simultaneously with distant metastasis, and there is no significant difference in the risk of isolated pelvic nodal recurrences, which is also very low, approximately 2% at 5 years. So this confirms that vaginal brachytherapy is effective, and with all the knowledge we know about the side effects, we have published about that, and the quality of life, vaginal brachytherapy remains the standard treatment for these patients. With regard to prognostic factors for recurrence, we included some of the risk factors that we have studied during the past years, that is specifically looking into LVSI and the quantification of LVSI, and we confirmed the prognostic and favorable features of substantial LVSI, also the prognostic significance of p53 mutation and L1CAM overexpression. And in this group, we could see in a multivariate analysis in portec-2 that external beam radiotherapy still significantly reduces the risk of pelvic nodal recurrences in this population. It does not have an influence on overall survival. So in the future, we take this forward in the next portec-4A trial, which will randomize patients between standard treatment and treatment based on molecular profile, treatment recommendations based on a molecular profile.